COVID-19, obviously, it's been a sustained disaster, and the recovery from it will likely be just as long, if not longer, based on the impacts that it has had to our economy, but also our mental health, the status of our healthcare workforce. The linkage between disasters and the myriad of disproportionate impacts that are faced by certain groups of people is really important to recognize and elevate, and I'm proud of Healthcare Ready to be a part of the community that helps to lift up those needs and draw attention to how we can address them, how federal partners can address them, how the healthcare supply chain can make sure that distributors and manufacturers have in mind the special needs of that of the end users of their products, and how much harder it can be for some groups to get access to critical needs than others.
Those communities who are typically hit by disasters, so we're talking about like the West Coast with wildfires or the Gulf Coast with hurricane season, is these communities go through consistent and overlapping disasters, and they don't have enough time to recover and be ready for the next emergency, whether that's a surge in COVID or the next natural disaster. And so they're often forgotten about and left behind. And, these impacts just continue to accumulate over time, and we continue to see growing disparities in the gaps of poor health outcomes for these communities. Something that we really looked to do in 2021 was to connect with our partners, and a lot of times the support there can help spread awareness about things like public health interventions or vaccines, and really get the word out that these are things that are available to help communities, especially when that trust is broken between local and state officials and the public. When we talk about resilience, we're talking about a community's ability to not only prepare and respond to a community, but to really be equipped to adapt to the challenges that they face.
And the need for further discussion on what it means for communities to have long-term recovery from a disaster.
But also to be able to adapt themselves to kind of go through that long-standing recovery process and better prepare themselves for the next disaster.
And I think with disasters impacting virtually everywhere in the country at any given time, it's more important than ever for us to be thinking about equity and how we kind of lift folks up from the systemic level as well, but also understanding that there may be a determinant related to why someone lives in a specific area that is more prone to floods versus others. And so we kind of have to think at this high level to get down to the low level of, all right, so how is this person going to be able to withstand a hurricane or a fire?
Our response exists beyond COVID, and that COVID is now just a part of the intense response that we provide in any disaster that occurs.